A dental implant is the most natural and functional solution for missing tooth. When a tooth is lost and left untreated, the jawbone gradually shrinks, adjacent teeth begin to tilt, the face develops a sunken appearance, and chewing becomes difficult, affecting nutrition and overall health. Bone grafting is needed when there isn't enough bone to support an implant, either to preserve the socket after extraction or to rebuild lost bone. Alternatives include a fixed bridge or a removable partial denture, but leaving the space empty is not recommended, as bone loss is inevitable. Implant and bone graft treatments are safe and highly successful, but no medical procedure can guarantee 100% success. Common post-surgical effects, pain, swelling, and infection, are managed with medication and cold compress. Implant failure is more likely in smokers, diabetic patients, and those on bisphosphonates or sometimes vitamin D deficiency. Nerve injury may cause numbness in the lip, chin, or tongue, usually temporary but rarely permanent. Upper jaw implants may affect the sinus, sometimes requiring a sinus lift. Bone grafts can partially fail or resolve. Peri-implantitis, infection around the implant, can lead to bone loss if untreated. Prosthetic components may fracture or become loose over time. Implant treatment involves 5 key steps. First, X-ray or CBCT scanning assesses bone volume and nerve position. If bone grafting is needed, it can be done simultaneously with implant placement or 3 to 6 months beforehand for larger defects. The titanium implant post is then surgically placed into the jawbone. Over the next 3 to 6 months, it fuses to the bone through a process called osseointegration. Finally, a custom-made crown is attached, restoring full function and appearance. Total treatment time is typically 6 months to over a year. After surgery, bite firmly on gauze for about 2 hours to stop bleeding and apply a cold pack for the first 24 to 48 hours. Take all prescribed medications as directed and eat soft foods for 2 weeks. Keep your head elevated when resting. From day 2, gently rinse with mouthwash, but avoid direct brushing of the surgical site for 2 weeks. Do not smoke at any point during the entire healing period. It is a leading cause of implant failure. Avoid straws and vigorous rinsing for the first 48 hours, and skip strenuous activity for 72 hours. Detailed written instructions will be provided before you leave the clinic. 2 additional treatments may be recommended. A temporary crown, or provisional, maintains aesthetics and prevents space loss during the healing phase of 3 to 12 months. Temporaries are not covered by most insurance plans, and a separate fee applies. They are not designed for chewing hard foods. A gum graft may be recommended if the gum tissue around the implant is thin or receding. Tissue from the palate or a donor source is placed to protect the implant, improve appearance, and reduce the risk of peri-implantitis. It is also worth noting that a retainer or night guard may be advised to prevent the opposing teeth from shifting. Your dentist will review all needs at treatment planning. Early response to complications is essential. Implant failure, shown by a mobile implant or pain on biting, requires a removal and a healing period before reimplantation. Peri-implantitis with signs of swelling, pus, or bad taste needs immediate professional treatment. Delay may mean implant removal. Bone graft failure with material exposure may require a secondary graft, and implant placement may need to be delayed. Nerve numbness after surgery should be monitored, and sometimes it should need an implant removal. Otherwise, it may need a specialist referral. A sinus complication requires an urgent return visit and possible ENT consultation. If a crown or component fractures, contact us promptly and avoid hard foods. For severe pain or uncontrolled bleeding, contact our office immediately or go to the nearest emergency dental clinic. We are always ready to help. Still, you have more questions. Otherwise, you are ready. Let's begin.